Hi everyone. So it's been quite a while since I've been online, and please ignore my unfathomable appearance. And yes, I'm going to just add our guest and we shall start. So, as you guys know, our topic for the day is going to be about social anxiety, and here we have ma'am. Hi, ma'am.
Hi, Yasoda. I've been listening to what you were saying, introducing yourself, that you look like a zombie. Well, I think you look fine. I think we all look crazy these days at home, right? And
Definitely, ma'am.
yeah, this is the closest I can come to these days for dressing up, just to, do a discussion.
It's so sad that all the clothes in the wardrobe are going to waste these days.
Definitely, definitely. And thinking about putting on and putting off the weight, sometimes we may not be able to wear those clothes again. Who knows?
Exactly.
Yeah.
Right. So, guys, we are going to be discussing about social anxiety today, as we had already posted and I just said. And it is one of the most commonly spoken of type of what do I say, psychological disorders. But as always, people fear to speak about it. So here we are to discuss about that today.
Yes.
So as usual, we have our guest, and all of us are familiar with ma'am now, and she's going to be enlightening us and giving us more information about social anxiety. So, ma'am, over to you.
Thank you so much, and happy to be back after a few weeks, I think, right? We could not
Yes.
organize a discussion, and I'm really happy to be here. And how anxious are you right now? If I ask you, are you anxious about the discussion? So I was thinking,
I was quite anxious because it's been quite a while since we had the
yeah,
discussion, and like I have not been very active on social media as well. So I was like, okay, how am I going to do it? Very conscious about how I would look. That was my main concern. And
that's okay. That's
we
completely
have been
fine.
speaking about lookism, but still, that's
Yes,
a matter of concern.
I remember we did a discussion on Lookism and the things we discussed, whether being helpful or not, right? So yeah, today we will be addressing social anxiety. I think it's timely, something that we need to address globally and in our society. So I was sitting here for a while and I was thinking, how anxious am I to go online and to discuss about social anxiety. So in psychology, we would say being anxious is fine to a certain extent. Now, for an example, if you're getting ready for an exam, getting ready to do a presentation, you need to have a little bit of anxiety because you need to prepare your body and mind to face the challenge. Now, we would say anxiety may be increased with cortisol, the stress hormone that released from the body, right? So, if this anxious level or anxiety gets increased, that's where the problem is. Now, before we go into social anxiety, let's try to understand what anxiety means. Now, a lot of people these days use the word I am anxious. I am anxious to start something, to talk to someone, talk over the phone, go somewhere, right? So, every one of us are challenged by a certain level of anxiety, right? But once you have these feelings, I would explain what kind of symptoms or feelings, emotions we have. If they are persistent, that's where the problem is. So, having a little bit of anxiety, like you are being excited, you breathe a bit intense, hard, your palms are becoming a bit sweaty, that's fine. But if you continue to do this when there is not a challenging situation you are confronted with, a sort of an unreasonable situation, I would say, then there's something wrong with your body, physically and mentally. And when we speak of anxiety, anxiety can be divided into several categories. panic attacks, OCD, obsessive compulsive disorder, where people would be obsessed with um, certain behavior types, and PTSD, post traumatic stress disorder, right? And also phobias, unreasonable or unnecessary fear that you may have towards an object, a situation, especially towards spiders, roaches. You know, there are a lot of people in our society who are in fear of these insects, right? So phobias. So when it comes to social anxiety, it's kind of different from the anxiety we usually feel. Social anxiety would go with the idea of that you are feeling down, you are feeling kind of lost in front of a crowd. For an example, you may not be able to speak to a group of people, thinking they may humiliate you, they may judge you, right? A fear of being judged, fear of being, or thinking, I'm going to lose my words. I can't present, I can't go on stage. I may lose my words and performance. You usually call that performance anxiety. So social
Yeah.
anxiety can be divided into, again, two divisions: the performance anxiety and interpersonal anxiety. So the performance anxiety would be the things that you do. Like, for an example, like what we do now. We are on a
Mm.
online discussion. So one of us can be anxious. Now, hypothetically speaking, let's say one of us have the social anxiety. We may start to stammer, we may start to sweat unnecessarily. So we might even forget what we are discussing and presenting, right? And then we have interpersonal anxiety, where you would have communications with people. You would meet someone, you would talk, you go to a meeting, you go to a party, a funeral. So you meet people and you talk to each other. So sometimes people may get shut, stuck, without having to express themselves because of anxiety, right? Now, this is, if this continues, if this is persistent, constant, the symptoms are bothering you, disturbing you, distracting you from your day to day activities, that becomes a disorder. So once it is diagnosed, you will be diagnosed under social anxiety disorder under the DSM, Diagnostic Statistical Manual of Mental Health Disorders, right? So that's the kind of a definition, description of social anxiety, how we need to understand social anxiety. But a lot of people take it rather easy, and some people may take it rather serious, but it depends on what kind of a situation you would confront. Some people are really good at confronting challenging situations. So they respond really well to fight or flight. You either flee or you either fight. Remember the Cannon-Barth theory we discussed in under motivation and emotion. So, but not a lot of people are ready to do so, right? So because of that, the symptoms of intense heart rate, sweaty palms, feeling nauseous, dizzy, even fainting can happen when somebody who has a social anxiety disorder. And that is a serious problem if it persists in your day-to-day living.
Yeah, I was just about to ask that, but you clarified it. So the issue is that sometimes people exaggerate. Now, as you told in the beginning, ma'am, like, for example, it's normal for us to feel anxious when you have to deliver a speech on the stage.
Yeah.
People commonly have it. And especially when it's the first time. And also there are times like when we are having to face an exam, or
Yeah.
when we are waiting for some kind of a very important decision,
Yeah.
we do feel anxious. But we find people confusing this normal feeling. I would say
Yeah.
normal. I don't know how normal it would be,
Yeah.
because it depends.
Yeah.
And but common situations like this are usually confused with the illness itself.
Yes.
So that difference the people need to really know, because they exaggerate when they normally feel this way,
Yes.
and sometimes when they are actually having the
Yeah.
disorder, they take it very light.
Yes.
So this massive difference needs to be understood by the people, isn't it, ma'am?
Exactly. Now, that's a very good question. How do we understand that we have social anxiety or social anxiety disorder? Now, most psychologists who would research on this have mentioned that when you feel like your behavior has changed and how you react to situations have changed. Now, for an example, all this time you were comfortable with taking a call, taking, an online call or doing a Zoom meeting. You did not feel, threatened by the situation. But all of a sudden you feel like you can't take a call because you get sweaty palms and you feel like you're going to push the task back. You don't want to do it anymore, right? So if that happens, you are kind of conscious about something has changed in your behavior. So psychologists have pointed out the best thing you can do is have a self understanding. Have my behavior changed when I react to a situation, a threatening situation for you? Now, for us, for some people, taking a call is not a threatening situation. But for the person who develops social anxiety, talking to someone on the other side of the line can be intense, can be a huge task. So if you feel that several times, 5 to 6 times, then you need to either address it yourself and understand my behavior has changed, and especially go to a mental health professional in order to see, am I having the social anxiety disorder, right? So I think people should not come to conclusions that, well, I am feeling depressed, I have depression, I'm clinically depressed, I have the social anxiety disorder. Let the mental health specialist decide that for you under the diagnosis, right? But what you can do is you can label your emotions. Now, if you want to address your social anxiety, if you have symptoms and you are aware of that, when you feel a little down and when you feel nauseous, you have a unreasonable fear of meeting someone. You want to cancel the meetings. You do not want to go to the relative's birthday party because you think people would ask questions. Try to understand and label your feelings. Why am I feeling this way? So, in this regard, most people have come to terms with their emotions and feelings. So, am I feeling this for a reason? Is this reasonable? What am I fear of? Why am I canceling my meetings? Is that good for me? Right? So, in that sense, you can probably tell yourself, or sort of a self realization, I may need to get help from a mental health professional. So, you should not disregard your feelings, right? And like you mentioned, some people may mix up these feelings of having the actual disorder for continuing for more than 6 months, and the normal way of feeling anxiety, like when you come online and do a discussion, we all feel anxious to a certain limit of time, like 5 minutes to 10 minutes, and we kind of ease into the discussion because it's a familiar a person, a familiar topic probably, so that you do not feel threatened by the situation. But it's very different from the people who have the anxiety disorder. So they feel threatened into a intense level where they might even faint if they feel like the situation is highly psychologically threatening them and they feel discomfort, right?
Yes. Then, ma'am, the next thing I wanted to ask is like, what are the possible reasons for someone to have social anxiety? Like,
Yes.
would it be genetic, or is it because some experiences they might face, or
Yes.
what can it be? So, will it be innate for them, or
Yeah.
but I'm not able to put it across the right
But,
way.
yeah.
So, or does it happen? Like, is there any possibility that a person can be normal,
Yeah.
not have the anxiety, and all of a sudden they
Yeah.
have it? So, can we just talk about that?
Yes, that's also a very good question. So The causes for anxiety, one reason can be you are misinterpreting a person's reaction to you, to your behavior. Now, for an example, let's say you go out to eat with your friends and there's a crowd sitting around you. So you see someone looking at you and you feel like the person is staring at you, the person is frowning at you, so you misread the expressions of that particular person, right? So a person who has anxiety disorder or develops anxiety is going to misread what other people uh, give you as expressions or even verbally, right? So there's a misunderstanding. So that would lead to anxiety. Now, for an example, you wear something really nice, but you go to a party or you go to a kind of an occasion and you think everyone is looking at your dress and judging you. So the idea of this judgment makes them feel more anxious. And another cause is genetics, like you mentioned, it's biological. But the psychologists have not found what exactly happening genetically. But people who have anxiety in the family, I would say it runs in the family. So you may be able to get it from your parents or a family member. And another reason would be that people having less social skills, underdeveloped social skills. So this is why we need to get our our youth, skilled in how to communicate, how to conduct an online meeting, go to an interview, face an interview, right? So do a presentation. So these social skills need to be developed. I think a lot of the times people think being shy is being anxious. But in psychology, we have come to know that being shy and being anxious is two different things. There are two different things. You can be shy when you are young, you're just shy because you are not familiar with the situation. But an adult feeling anxious about not having to conduct the meeting and all of a sudden you cancel the meeting and think, oh my God, I want to go home. I can't face this meeting. I can't talk to the people. Then you need to address that situation. Then something is wrong with yourself, in the sense I'm saying that you probably go through social anxiety disorder, or we would say social phobia, due to a certain reason. So this can actually go into the past as a childhood, when you are a child, in your childhood, that your parents may have not encouraged you to talk to people, maybe, not.
I was about to ask that question.
Exactly. So sometimes parents would say, don't talk to people. You're not supposed to, especially women, right? You need to be in silence. If a girl talks, they would say, my God, you're not supposed to talk like that because its culture doesn't permit. So I'm glad that you pointed out, because I was about to address that culture and social anxiety are connected together, right? Both go hand in hand. So if you look into our culture, I think most women are not allowed or not regarded as to be, good speakers. They should not, because of the cultural idea of femininity and how your personality should be. So these women may not develop their social skills when they become adult women, right, as girls. So this is one issue that we have. Why, for some reason, people who are in the eastern regions in the world are kind of backward when it comes to doing adventurous things, I would say, tasks, and going forward compared to the Westerners, right? So when it comes to these mental disorders, we should not forget that as much as we talk about biology, we need to address the social situations and culture as well, because culture is well connected with our psychological elements, right? So therefore, those would be the primary causes for social anxiety. And I would highly go critical about the cultural components of sort of putting someone down for talking. Like when you are children, you talk and you want to do things that sort of satisfy you as children. So I think parents have to understand that. I'm not saying parents should let children be mischievous or be stubborn. That's not what I'm saying. But to sort of discover their abilities and capabilities of what they can do. So once if it's shut down, these children grow up to be adults without any positive social skills, which lead to social anxiety.
Yes, and like even situations of talking about parenting, like when parents tell like you should not do this without my permission.
Yes.
So there are instances where kids get beaten up for talking too much to someone or like running about the place.
I
So
know.
the thing is, especially in our culture, I would tell that the parents do not know up to what extent they should put that barrier to the child.
Yes.
So after a certain stage, the kid starts having the issue
Yeah.
like, am I allowed to talk right now?
Yes.
And am I allowed to do this right now? So they
Exactly.
always wait for the approval of the parents. So that's
Exactly.
another major issue, especially in our country.
Exactly. That's very true. We always seek for that permission because you are used to someone telling you not to do it. So as an adult, you think, should I do this? Or I should talk to my parents, even though you are 40 or 50, or you still need the permission. But that again is a sort of a issue with your personality. Your personality may not develop. It's a problem for your self-efficacy and self-esteem. So social anxiety would line up with self-efficacy, your self-image, your self-concept, uh, what kind of values you give to yourself, whether you are confident in presenting yourself, what kind of a personality would you have, especially in the public arena, right? Now, one other thing about social anxiety is that some people are anxious in one situation and they may be feeling comfortable in another situation. For an example, a child can be, let's say, a teenager, a youngster can be good with the friends talking and hanging out, but when it comes to the classroom activities of doing a presentation, he or she can be very anxious. So this social
They
anxiety,
would love to pass it on to somebody else.
yeah, so this may work very differently. So we should not regard that social anxiety is applicable equally in every situation, but this can differ from person to person and with your personality
This
as
is
well. So even an extroverted person can be socially anxious given the situation that he or she feels threatened by the crowd or the environment and gets shuts down and feel nauseous and dizzy, and having to go to the bathroom a couple of times. I think we have come across people like that, right? So we need to be very cautious and be respectful of them. Now, there's something that when we actually discuss about social anxiety in psychology, we need to understand other people's warning signs and for yourself as well. So kind of cues of understanding the behavior. We should not let these people down, demean them, saying, what's wrong with you? Why are you sweating? So sometimes people
yeah.
joke on them, right? We should not do that. We need
Hmm.
to understand this person must be going through a discomfort situation. So how can I address this? We actually, in psychology, we call it I actually wrote it down, being productive worries, having productive worries. So you worry,
Mm.
right, for yourself, or someone is being worried. So how do you help this person, right? You would ask, can I help you? Would you like some water? How can I help you in this situation? So rather
Yeah.
than trying to make the person more panicked, more anxious, you can try to help the person to ease the situation down. So a person feel a little comfortable, right? And also you can, let's say if you are the person who's having the social anxiety disorder, you can build your own coping mechanisms. What can you do, right? Now, sometimes I think some people take their favorite books in their bags. I've done it because having something that is familiar to you, sometimes when you are in a different, I wouldn't say threatening, but unfamiliar situation, having something you like makes you happy, makes you kind of comfortable, right? Some people take their favorite pen, or I don't know. This sounds maybe crazy to some people, but people do this, and I have done this
Yeah.
myself, right? So something familiar to you. So find a coping mechanism, like listening to music, taking a walk, talking to someone who would listen to you without judging you, are the mechanism you can use as a person who has social anxiety, right? So if your friend or family member has it, you can help the person to ease the situation rather than demeaning or humiliating or joking about it, because anyone can develop social anxiety at any point of time in your life. So put yourself into other people's shoes and be empathetic. It can happen to you.
Yes. I keep having this feeling that many people, I'm not being like positive about it,
Yes.
but I have the feeling that after this pandemic situation, and even right now, I would say that many people are developing social anxiety
Yeah, definitely.
because stuck at home, no access to any form of social interactions,
Yes.
probably a phone call or two, but
Yes.
still, um, especially when it's coming to working online, even
Yeah.
I do it because most of the time, like having to work with the electronic devices, sometimes I do not respond to messages or
True.
I don't want to pick a phone call because it's so tiring and like
Definitely.
it's so stressful. So I'm sure that many people out there are also going through this, and like once this is over, many are going to be victims of this particular disorder. Like,
Definitely.
what do you feel about it, ma'am?
To be honest, I feel terrible about it. I feel like I am under a lot of pressure right now. I feel like I'm sort of having a little bit of stress, and I think I I kind of use my stress to be productive. So you can use your stress and you can use your fatigue to be productive, and not everyone does it. And I think some of us who are reading into psychology and has an idea about these, not I would say mental illnesses, but these changes, can know what coping mechanisms would be there for us to develop, but not a lot of people know about it. So the post pandemic or during pandemic anxiety has been globally discussed. Now a lot of other countries have come to the discussions of post pandemic situation, because they are again going back
Mm.
to work. Their countries are opening, the bars are opening, they are partying again, traveling. So but for us it's still pandemic. Even after 1.5 years, we are still in the pandemic situation.
Yes.
Now we have gone to another lockdown. Now, to be honestly speaking, as a person in psychology, these lockdowns and not having communication with people, the limitations that we have for socializing are completely affecting us psychologically. Because personally, I know people who would complain about being stuck in a house by themselves, not having access to things that they need to buy or to do, and not having people to talk to, because everyone is going through this uh, intense situation, not knowing how to react to this, right? So I think all of us are challenged by this during this current pandemic situation, uh, rather than physically, but mentally. Our psychological levels of how we understand the situation has changed. Our entire behavior, our daily routines have changed. And maybe this is by force because we have no other options, but we may not see the results right now, but we may see results in years to come or months to come of what we go through right now. So, to your question, the anxiety that drives us right now is not very healthy. But for some reason, since we do not have any options, the only option we are left with is to positively channel these emotions and the situation to be productive. So, what can you do at home? If you're not a person who's working at home and if you have nothing to do, if you're a person who has been socializing, going out, taking a walk, you may not be able to do that. You are probably forced to find a hobby. But rather than thinking about this is by force, you can tell yourself, well, I'm going to use this time productively to enhance my skills, So if you want to read 5 to 6 books within a month or 2 months, we don't know how long the lockdown or how long we will be here at home. So you can arrange a plan so that your brain will sort of get adjusted to that. Otherwise, the more you think about the situation as intimidating you, challenging you, oh my God, we are under a lockdown because of the pandemic, that's not going to help you at all. And at the same time, I think when you are exposed to news items that this amount of people have died, this amount of people have been affected, that's not going to work positive in your mind either. So if you can limit
Yeah.
listening to news, so listen to your news in the morning and do not listen to it the rest of the day. So program your day that you're going to listen to these negative news in the morning and you are going to do something productive to keep you going during the day, right? Now, some people will argue, well, I have to be updated with news because I am so anxious that I don't know what's happening around, right? So, but
Probably some of them are like obsessed
exactly.
with keeping in track with the number of cases and all that. Yeah.
Unfortunately, that doesn't work good for you. That actually gives you a negative vibe to your mind. The mind gets fatigued. Our brain is a muscle. This muscle gets restless. So, not having enough sleep, not having enough peace to your mind will definitely affect you negatively. So you may not feel it right now, but in days to come, you will feel like I have lost my weight. I feel I can't sleep properly. My mind cannot focus properly on things. Those are the little red signs, red flags we can see in our behavior, or we can see someone else has it, right? So you need to be cautious and conscious, at least this during this period, that we have no other option but take this situation as a challenging situation, that you react to it positively. And I am personally critical about people who would go and panic others, saying that, look at this news, I'm sending this news, you should read it, and you be panicked about it just as I am panicked. I think that's really selfish, really bad. At this situation, what we need to do is make sure other people are doing okay. We should not fuel their social anxiety, right? So we should be using empathy in this situation to make sure that other people are doing good rather than panicking them about the situation. So, and personally, I'm a person who's not very happy about the lockdowns, right? That is my personal idea. Other people may have different opinions. The only reason I am opposing lockdowns are if it is not properly planned, this is going to affect our children, their behavior, their learning phase, and their cognitive phase, and also our behavior, because human self is complex. Our behavior is connected to our body and mind. It's a complex system. You can't change this within 24 hours or 48 hours. It has a negative impact on people's minds. So I feel like this would rather breed a people with a lot of psychological issues in our country, probably affecting their self-esteem, breeding social anxiety, breeding phobias. So many psychological illnesses to come. So we need to be very cautious when we make plans for a society, especially thinking about other people's behavior and mental health. Like I always say, mental health is not important to Sri Lankans, at least to some Sri Lankans. It is not about mental health. Mental health is, I don't know, forgotten, disappeared, right? But the moment we come to not enjoy, but go through the repercussions, it will be too late for us.
Yes, definitely. It's a never-ending cycle we have.
Exactly.
Like just a
Exactly.
few are educated about it, and then they speak about it for some time, and it's always a seasonal behavior. Whatever happens, especially in our country.
Yeah.
So it's hype for some time, and then it's gone. buried. So
True.
that's the sad reality in most of the cases in our
Definitely.
country. And you just spoke about the coping mechanisms, and that was really good. And I hope it would be useful for people,
Mm-hmm.
especially in the time period that we are in right now. So,
Yeah.
ma'am, besides this now, these ways of finding a hobby and all these mechanisms you just pointed out right now, they are things that we can do for ourselves, like to avoid falling into any kind of difficulties.
Yes.
But if I say, if we are not able to handle it ourselves, now
Yes.
most of our people think that way,
Yeah.
like I'm a strong person,
Yeah.
people think that I'm strong,
Yeah.
so I don't need help, so I don't have to go and ask anybody, I can deal it on
Yeah.
my own. And
Yeah.
from bad it goes to us. So in case if we find that we are not able to handle it ourselves, how do we seek treatment, and what kind of treatments are available for social anxiety, ma'am?
Oh, in psychology, there are a couple of main treatments are given for social anxiety disorder. So people have to be educated about this and aware about this. Now, one of the things that we do is if you go to a mental health specialist, after you get diagnosed for social anxiety disorder, you can either go for psychotherapy, and under psychotherapy, you will be exposed to cognitive behavioral therapy, which is your therapist would work with you to change your negative emotions and feelings and thoughts to convert them to positive thoughts, positive thinking, because thoughts give rise to actions. So, therefore, cognitive behavioral therapy is one of the key therapeutic methods for social anxiety disorder. And another therapy would be exposure therapy. Exposure therapy should be taken under a therapist. You can't do on your own. What you do is in that therapy is your therapist would expose you to what you fear. Now, for example, let's say you are fear of spiders. So you can't touch a spider, you can't look at a spider, you can't stay near a spider. So your therapist would come with a mechanism how you are exposed to the spider gradually, not right away, right? It's like you walk into a room and your therapist like, drop a spider on you and say, okay, now start dealing with it, right? So social anxiety is dealt gradually. Like, for example, if you are a person who has anxiety, talking to a crowd, you can gradually develop your skills of talking probably to two people first and then three people, right? So in the exposure therapy, you can be referred to or you can be advised to join a social support group. So in that social support group, you will meet people who are diagnosed under social anxiety disorder so that you guys get to talk to each other under the supervision of a therapist and see what kind of coping mechanisms that you can exchange and share and talk about when you are challenged with a situation. That's on the side of psychotherapy. And apart from psychotherapy, you can go for medication. So this needs to be decided by your medical or the mental health professional. So you can be put under anti-anxiety medicine, antidepressants, or beta blockers. Now, anti-anxiety medicine usually works very quickly compared to antidepressants. The moment you take it, the body reacts to it. So therefore, a lot of psychotherapists and psychiatrists are very careful giving anti-anxiety medicine to patients for a long period of time. So less than 3 months can be used. The medicine can be used for less than 3 months. If not, the patient is going to be addicted or dependent on the medicine. And antidepressants can be used. Usually antidepressants take time, unlike the anti-anxiety medicine. So even though it takes time, you have a chance to get addicted to antidepressants. So this is why a psychiatrist would put a client or a patient for less than 6 months, a cycle of less than 6 months of medication to avoid this addiction, right? And then beta blockers. What are beta blockers? They are the class of medication that sort of control your heighten heart rate. Now, when you get anxious, your heart rate starts to go up, palpitation, abnormal heart rate. That can lead to heart problems, strokes, right? And kidney issues. So, all kinds of complications can happen. So, to avoid having a second heart attack, right, for a person, beta blockers are being used. So when you get anxious,
Mm-hmm.
some people who have social anxiety disorders can get a stroke and die, right? Because they are, to that extent, their cortisol works really intense. The amygdala, amygdala is the part of the brain that gives meaning to our emotions, what we feel. So if these things work abnormally intense, you probably can damage your system. So anti-anxiety medicine, antidepressants, beta blockers, and psychotherapy, cognitive behavioral therapy, exposure therapy can be used under psychology or going to a counselor. So the counselor can refer you to a psychiatrist or a clinical psychologist for medication. So depending on how intense the situation is, your mental health professional will help you, will guide you what to do. Apart from the coping mechanisms you would do. Because like you said, some people think, well, I can control this situation. But there is a time when you are having the disorder, you may not be able to look after yourself and control your emotions. And this is actually to go with your emotional intelligence. So the research has been done to say that once you feel anxious, once you have the disorder, there's no going back. You are going forward with it, and your daily routine, your life will be distracted, right? So this is why it is highly advised, if these symptoms are persistent, you must work with a mental health professional who can probably diagnose you under anxiety disorder and get help. Help is needed. So people need to come to that senses, come to that level. I can't control my emotions and my thoughts. I need help, and that is not something to be embarrassed about. Like I always say in Sri Lanka, we have counseling services, we have psychotherapy services, we have psychologists in this country. Please make use of them. Please go to them, talk to them, consult them, and get help. So you might save
Yeah.
yourself. Right?
True. And probably talking about the treatments, maybe we could do a separate session on
Yeah.
that, because many people have this misconception that if I go for treatment and just as you said, antidepressants, anti-anxiety medications, so they
Yeah.
lead to addiction when you have it in the
Yes.
long run. So
Yes.
people have this fear also. Okay, if I go for treatment, they're going to give me medicines and I'm going to get addicted. I'm going to have side effects. So
Yes.
probably we may discuss about this as a separate thing in future, about what types of
Yes.
treatments, because we don't immediately be get prescribed with medicines
Yes.
as soon as you go for treatment.
Exactly.
This understanding also has to be there
Exactly.
with the people.
I need to add to this, some of the anti-anxiety medication and antidepressants, like countries like in United States, you can't get them off the counter in the pharmacy. You must have a prescription from a doctor, a
Mm.
mental health professional. But when you research into that in Sri Lanka, some of these medication can be taken off the counter. I'm not trying to tell, encouraging
Oh.
these people, but you should not do that. If you think that
Mm.
if you get exposed to this medication, you should not take it without the supervision of a mental health professional, because it may lead you to different other mental illnesses of addiction, and abusing of medicine can change your brain chemistry, the way you think, your behavior patterns, your mental process, and that is not a joke. So people should not take this medication just because someone is recommending them for you. So this is why countries like United States go with under FDA and have strict rules that they cannot get this medication over the counter in a pharmacy. Unfortunately, sometimes we do not have these laws in Sri Lanka. So you can go to a pharmacy and you can write the prescription in some people do that. I know people who have done it. So
And the other weird habit people have is like they have a prescription they got like around 5 years back and they still keep using
yes,
it to get the medicine. Like
yes,
they
exactly,
don't know if their condition has improved. They
exactly.
don't like have revised sessions with their doctors, like not just in the case of psychological
Yes,
treatments, but even the
yes,
other physical ailments people have. They don't go for doctors to check
yes.
whether there has been improvement or not. Even after 10 years, they use the same prescription to
I
get the
know.
medicines, and then when they have a pain, they
I know.
intake them.
And the other thing about this is people do that because of the fear that they are being judged by the society. So if they get one prescription, they think they can use it for the rest of their lives. But mental illnesses don't work like that. You have to change the dose, you have to change the treatment plan as you develop, right? So sometimes when we take a medication more than for 3 months, our body tolerates
Mhm.
it. If the body starts to
Yes.
tolerate it, there's no effect, there's no development. So your psychotherapist or your psychiatrist has to change the treatment plan. But some people do not research into this, ask questions. They think, oh, I got the prescription, I don't have to go to the doctor again, I don't have to be on the line, I'm going to use this. So this is, in a way, it's humorous, but it's not humorous when the results come out, because
Yes.
this is dangerous. It can lead you to, harm yourself, even commit suicide at some point.
True. So yeah. So all what I had to ask, everything I had in mind, I have asked.
Yeah.
So I hope we have covered the. I know, like one session is not enough for us when we get into depth of discussing these things, but I hope we have been able to convey the key
Hmm.
information that the public needs to know.
Yes.
So yes, ma'am. So I'm done with my questioning, and as always, thank you so much for joining me. And it was, I know it has been productive, and I hope it would be useful for people.
I enjoy having these discussions with you, and I'm sure if there are anyone who has questions, we can help them by answering them. They can write to you, and so that we can,
Definitely.
get back to them with the answers they want to hear. Not in a bad way, I am saying, but we can help them
Yes.
with information,
True.
right? So I think that's what's our purpose of having these discussions, of making the community, our society aware, and looking into the ways that if there's something that you do not know, how we can learn about it. One suggestion I would say is, during this pandemic situation, try to be positive. That's one advice I can give you from being a person in the discipline of psychology. Being negative about it, being panicked about it, is not going to help you in the long run, because uh, you will consciously put yourself in a negative phase, and you may not be able to go back to how you were when the country is open, because we have to go back to how or what we were
Yes.
doing, because at some point the pandemic is going to be over, and we still have to go and meet people, talk to people, whether you have anxiety or not. So you can prepare yourself to being positive. How am I going to face this situation? Because nothing is going to last forever, and this bad phase will be over at some point. So then prepare
Yeah.
yourself to go forward, not to go backwards and damage your psychological well-being.
Yes. And as a final note, what I also would like to say is like it is okay to not feel okay, and
Yes,
it is perfectly all right to seek help. So don't ever forget that.
yes,
That's something important that everyone needs to hear.
definitely, definitely. Thank you so much, Yasoda, and had a great discussion. And thank you for everyone who took part and listened to us, as always, supported us.
Yes. Yes, thank you everyone, and thank you so much, ma'am. It was really nice to have a chat with you, and it's been a quite a long time
Yeah.
since we met also,
Yes.
and hoping to see you soon
Yes,
again.
definitely.
Bye
Definitely.
bye, and
Bye.
have a good
Bye,
evening ahead.
everyone. Yes.
Take care. Bye bye.
Yeah. Stay safe. Bye.